Like if you need to look at all of our sessions, I'm gonna record. So if you missed a session or you need to look at it later, we can do so. Sometimes this syllabus link, it takes a couple of tries. Okay. Well, the class is essentially your basic clinical procedures that a medical assistant would typically go through the course of the day. Ms. Cadet, are you currently working clinically or in the medical business?
Or in the medical business?
No, I am not.
No. All right. So good. So who else? Let's see who else is on. Oh, it's just us two. So you're not. So this is this all new to you? Do you know how to do like vital signs and any of that?
Signs and any of that?
I do. I actually went to school years ago to be an LPN, and I had like 5 months left, but due to familial issues, I actually had to leave. And I was at a career institute at that time, so none of my credits or anything would transfer over, and it was so long between that I would have to start the program all over again.
Okay, so
that's what happened.
So it's good. So at least you had some exposure. This is not like totally foreign to you, the things that we're talking about. Okay, so that's essentially what this course is. Ms. Cadet, on when you're not talking, put your mic on mute so that there won't be any like feedback or my voice won't be repeating itself due to the lag. Alrighty, or I could mute you. I could do that as well. All right, wonderful. Okay, so let's go over. Let's see if the syllabus is cooperating with us. Here we go. Now, this particular course, and thank you very much for your other counterpart. I believe there's only 2 or 3 of you for this particular class. The other student, she wanted to meet a little earlier, so we met last night. So it might be just me and you, or me, you and one other person on Friday mornings. But Friday mornings, probably from 9 a.m. To 10 a.m. We'll kind of like do this overview. But the way I'm trying to make this course is to be self-contained, so you can do things without having to wait for me. My contact information, here's some of it. Also, it's on the front here on your instructor bio, and also it's in this part here. Whoopsies. Announcements. And of course, thank you. You got to see your Zoom meeting. Now, what are we doing in this course? Well, there's going to be some parts where we're going to be talking about asepsis, because in the clinical arena, or the laboratory arena, which you could be working in as a medical assistant, you need to know, like, why do we hand wash, the importance of hand washing, and there's a term, asepsis. And if you recall your medical terminology, sepsis means, like infection or bacterial infection or viral infection, and A means no or not. Now, we never get to that level, but we can get to as clean as we possibly can. We also have QC, which is quality control, within the medical office. Many times I have medical assisting students like, oh, why do I have to wash the windows? Well, in a normal office, washing windows seems like a mundane job, but it's important. Things of that nature, like taking care of the medical office, is crucial and you now know, the world now knows how crucial is cleaning, making sure everything is clean, because the world has seen what infectious medicine already knows, how easy it is to transmit a pathogen. Screen and follow-up tests, we're not going to go up as much because you have a whole entire class, MED260, regarding tests and things of that matter. Wait, why did I scroll down? Oh, here. We're going to go a little bit of the different types of shock. Shock is when, for whatever reason, your cardiovascular system can no longer pump blood to its periphery, and also, if you can't pump blood to your fingers and toes, you probably can't pump blood towards the vital organs such as your brain. And that's what, when they say, in movies and things, oh, she's going into shock. They're not getting shocked as in electricity or emotional. They're talking about the impending failure of the cardiovascular system. And of course, infectious process, that's part of your asepsis, hand washing. And the big thing here is, especially in the first couple of weeks, is vital signs. And that's the main chunk of your laboratory. So vital signs comprises of taking blood pressure, and not the shortcut way. We will be teaching you the long cut way. And the long cut way only takes like 30 seconds more, but it, especially in laboratory, I'll be showing you how that extra 30 seconds makes it much, much more accurate. And then when you go out to the doctor's offices, because after a while, you're going to see so many shortcuts. And for the typical patient, the shortcuts work. But for a patient that has no symptoms, that's asymptomatic, and has very high blood pressure, you could miss it. So, microbiology testing, I don't think we're going to do that. But if we do, wound cultures is when we're trying to grow some bacteria. But you have an entire class over that, and I believe that's located in another class. But I could be wrong. It's been a year since I taught this class, but I've been teaching this class for forever. Also, just a little background on me. I used to be a medical assistant many, many moons before. And I'm always promoting medical assisting because at the time I didn't want to get into medical, but then the next thing, one thing leads to another. And it's amazing. Like 10 years later, 15 later, you're a doctor. 10 years after that, you're a professor, publisher, writer. It leads to so many things. And also, the beauty of medical assisting is that you not only learn your clinical aspects like this class, you also learn the important administrative things that you have to do as a medical assistant, which, by the way, that's the hard part of the job, really. The clinical part is the fun part, the part that everyone loves. That's why this class is a lab class. We'll probably be having labs after week 5. Once Northern Virginia is well into phase 1, and also once we are cleared by the university. They're looking at week 6, 7, and 8, and it will be done by appointment. And we're a small class, so we don't have to worry about a whole bunch of us bunching up and violating any of the CDC guidelines. Now, the textbook is your medical assisting textbook. This is a really nice book. It gives a nice overview. I also recommend utilizing this book for reviewing your anatomy and physiology. Also, most of you are probably at the end stage of your medical assisting training. You should start looking at studying for your registry exam, CMA, your CCMA. And if you're interested in that, shoot me an email. I can get you some material that you can practice. because that's also the key regarding exams is practice, 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 looking at things multiple times, and also actually practicing what you need to do. Don't go into a registry exam, don't go into a certification exam. And for future reference for any nurses out there, don't go into your T's blind, like, oh, I looked at the exam, I know what it's like. No, take a lot of practice exams. That's the key to acing SATs, ACTs, and all the alphabet soup that you'll need to take for the rest of your life. Now, the delivery, of course, this is hybrid. We'll be doing this via Moodle, the majority of it, and we'll be having 1 or 2 laboratory sessions after right around week 6 or so, and that'll be announced way in advance. But again, we're waiting upon approval of the university, and also we want to see what the governor of Virginia is going to do. Now we're going to have discussions. Now I don't call them tasks. I give little homework. Now lesson is attending attending the lectures. And if you cannot attend the lectures, please inform me, and I'll give you an alternative assignment so that your grade can for your lesson can be sufficed. And now let's go over real quick on discussions. Like, you're gonna have a discussion here. I also put in here an online discussion rubric, and this is the top of your Moodle shell page. This, of course, is your announcements. Really, really important, right? I'll put my contact information there, and of course the Zoom number. And here's your textbook, that medical assistant textbook I was talking about. And look at this citations and online rubric on how to cite things. Oh, it's no longer Kimberly Olkers. Let's fix that. Turn editing on. Your librarian now is Ms. Zoe Page. Right, Ms. Zoe. Oopsies. And you can contact her at zpage@stratford.edu. And, you could try calling the library. We have a system where the messages get transferred to our email. But the best is, if the messages get transferred to your email, I just contact the person directly via email. And there's if you click on that Microsoft Word document that's right here, it gives you an example on how to cite. And also some other tips is try to use a .org, .edu, preferably from a medical school or a nursing school, or a .gov from a Department of Health or National Institute of Health or the Center for Disease Control, because those are better citations. Those are better sources. And remember, try to keep your sources within 5 years, because if we're talking about something technical, then here's an example I always use. Your cell phone is old. So 5 years ago, a cell phone is old. So if 4 years ago is old, just imagine more if you're talking about something technical like medicine. Even now, stuff that was 2 months ago, especially now regarding the virus, is already outdated. Now, I put notes, and the chapters should match the chapters in your textbook, but the pages may not, because I used the edition prior to this edition. One of these days I'll change the page numbers, but it is the same chapter and notes. So let's look at real quick at the discussion. How does one handle an angry patient or a potentially psychotic patient? And if you recall, OSIS means abnormal condition, psych means mind. So if someone's out of their mind, every time we as human beings, we lose our temper, there's a brief moment that we're a little bit out of our mind. and these discussions are due next week. So week 1 discussion is due in week 2 discussion is due at week 3, that kind of thing, right? And if you're submitting something late, if you look at our late policy up here, it's like for every day late, that's a grade off. But please inform me, because me having to chase you where your grades are it gets really cumbersome. But you have to do your due diligence on your side, and I'll do my due diligence on mine. So please email me so I can catch up on grades. Now, honor code and honor code violations. If you're caught cheating, what's the worst could happen to you? You get a 0 for the class, or you get a 0 for the assignment. The thing about the honor code is that we medical professionals, that you have to be ethical, because if you get caught in the real world, you'll not only be terminated, there'll be criminal proceedings, because in the real world, it's more than an honor code. It's you're now affecting people's lives. All right. So, and also thank you for anyone who hasn't met me yet, and introduce yourself. Again, I will reply to you today. And in the introduction of yourself, I'd like to know why essentially you chose this, because if you chose this business for money, you chose wrong. But if you chose this business for other reasons, for human reasons and passionate reasons, and the number one reason is that you pretty much care about your fellow human being and want to do something about their suffering. Yeah, that's a common thing, but you could also have other motivations on top. All right. So this week is so back to this, how to deal with the patient. Now, all your discussions should have your opinion and your answer, of course. And then you should have a rationale. Why do you think your answer is the best answer? And then the most important part, did you cite something, or cite a source, or cite some evidence that backs you up? Okay. Now, don't worry too much about like replying to your other classmates, because I believe there's like only 2 of you. So yeah, you can reply to your other classmates, but I want you guys for the first week just to focus on your initial post. Initial post has to be at least 200 words and should have, of course, your opinion, a rationale, and some evidence that'll back you up, and an APA cited, APA format citation. And again, all of the things that I just said will be up here as well. And of course, watch your grammar, watch your spelling, make sure that it's organized, because many students, they write like they talk, and that's not a good thing. So go on Microsoft Word before, write everything down, read it to yourself, read it to somebody in the house, see if it makes sense. And also, this is how I also look at it. If you can take notes on it and the notes make sense, right, then odds are it makes sense. For part of the laboratory, so look at this hand washing rubric. It just explains on how to do hand washing, but I'll probably also put a video on hand washing. I'm hopefully going to get to the campus by Monday, so I'll do a video on basic clinical hand washing. Microscope parts, if you haven't seen a microscope in a while, look at this, because remember we mentioned in the syllabus that laboratory procedures and microscope stuff is also part and parcel of this course. So this is a nice review. Okay, let me just, I think I yapped enough for now. Ms. Cadet, is there any questions that you have?
Ms. Cadet, is there any questions that you have so far?
Oh, you already unmuted. No, I have a question right now.
Okay, so let's proceed to the lecture proper. If we're okay with, I also forgot how to do grades. That's important. So every week is like 10%. So there's 10 weeks, is 10%. So you do everything for the week, that's 10%. So the class is conducted where everything, where it's like, it's not like one big exam or one big anything. Um, the discussions here are, they're marked really low, but I'm telling you, that skill set of being able to communicate your opinion with a rationale, with evidence is really, really important. Homework and tasks, but being available for the lessons and my quizzes. I put weekly quizzes up, and you could take them at any time. I haven't put it up yet because I want you guys to start looking at chapter 6, chapter 9. But I'll put up probably put it up by like Sunday, and then you just email me, or if it's in the Moodle, just take it. And if it's in Moodle, you could take it as many times as you want. And they're quick quizzes, 10 items that just gives you a little bit of a flavor of what my final exam would look like. Okay, now for this week, it's office environment, general safety measures, and OSHA regulations. OSHA is the Occupational Safety and Hazard Administration, and it is the main reason why we do what we do. Now, government agencies like OSHA and CDC, they have no real power to themselves, but if they report you to other departments or other government departments, then that becomes a problem. Especially in the hospital setting or in the clinical setting. OSHA reports you to JCO, which is also known as the Commission. It's the Joint Commission on the Joint Commission on Hospital Administration. That's a problem. And then if JCO comes sees you, that's a real problem. The hospital atmosphere is already stressful, but when there's a JCO visit, it just gets ramped up to 100. So that's what we're doing. And of course, since you've been on this session, you get attendance. My attendance, I usually post it around like noon on Saturdays. And in order to garner attendance, like this person here, you put in a post, or you do some homework. I cut you guys some slack this week. I didn't put any homework, and because there's some various things that you still have to look at. But I'll be also putting a quiz as well. Okay, and that'll be your 10% for this particular week. So let's jump right in. Let's look at what we're looking at. And of course, I have an old lecture video of both these chapters, and it's right here. And if it doesn't play well for you, shoot me an email. I could look at it. Now, oops, and it's also pertaining to, if you look at the notes, you could see they're pertaining to these cases. And let's open up the textbook. And I'll open up the textbook on one side, and then you could see the case on the other. And of course, your textbook's up here, Red Shelf ebook textbook. And I click on that. And it is this blue textbook. Or is it this, which is one? This is the clinical procedure. There's for this particular class, there are two textbooks. One is just has all the rubrics, which I also put separately. And the other one, I think the blue one here, that's the one that has like all the chapters. Let me look if I'm correct. The blue one's the one with all the chapters. Let's start reading. Yep. Or maybe I'm wrong. It's the red one with all the chapters. Let's see. Yeah, the blue one is with all the, it has nice little homework, nice little quizzes. It also has an outline of all the skill sets required. And this is also a nice review. So let us go to the red one. I hope that has all the chapters. Okay. Now, upper left-hand corner, you have your table of contents. And let us jump to, we're going to unit 1, may have chapter 6 in it. You can open this up like this. Nope. So unit 2 has chapters 6 and 9. So you click on the little arrows and then you go on 6. And if you look at here, let me move this over. You have the case of Ms. Shana Jones. And if you recall, cases have subjective, objective, assessment, and a plan. So the subjective is the history. So let's look at her history. Ms. Shana Jones, she looks relatively young. She has known allergies, cinnamon and peanuts, currently seeing Dr. Elizabeth Williams, patient number, and this was her plan. They had wound culture and sensitivity sent to the lab today. So she's relatively young, 34-year-old female. Now, what's missing here is typically her work or her occupation, because your occupation leads to the diagnosis as well. For example, who's most likely going to get a musculoskeletal injury? A person who's a police officer walking around the streets all day, or a person who's like me, who sits in front of a computer all day? Of course, it'll be what? The police officer. They're the ones who are always out there, and the odds of them, getting a broken bone or a twisted ankle or something of that nature is far greater than me. I also have a low stress job. That police officer has a high stress job. Who is more likely going to have a cardiovascular incident? Most likely that police officer. Me, not so much. Right? It's one of the 101 reasons why I'm no longer a physician, because I started having health issues because of stress and things. It goes, if you start paying attention to your health, and the beauty of education is you can then modify your career, modify your occupation, so to benefit your health. She was found with the chief complaint with a swelling and a red pustule on her face. Now, the next part is your history of present illness. She stated that the problem started 2 days ago. It started as a pimple. Now it's become irritated and extremely swollen and painful. And she's female. So if she's female complaining of pain, that means it hurts. If it's a guy complaining of pain, it's a guy complaining of pain. Because female patients have a much higher tolerance for pain. But the beauty of female patients is if there's something that's bothering them, they go to the doctor. Male patients, if something's bothering them short of erectile dysfunction, they will not go to the doctor's office. They will go kicking and screaming, and I'm one of them as well. I only go when I'm in real trouble. So this morning, now that she has yellow drainage on her face, swelling is worse, everything's progressing. Now it's 1 centimeter in diameter. It is no longer a pimple. It is starting to become a mass. So she rates the pain 7 out of 10. And like I said, if a woman says that it's 7 out of 10, it's 7 out of 10, and it's considerable amount of pain. The physician thinks the condition may be impetigo or methicillin-resistant Staphylococcus aureus, MRSA, MRSA. Right. So now that you know that, now that you see that on a chart, shouldn't you be gloving up and wearing your PPE? Right? Should you be talking so close to her? No, because you shouldn't be, because now you know she's infectious. So skin resistant, and the thing about MRSA is it is extremely tolerant of medications. Okay, so you have to be aware. And VRSA, right, which is vancomycin resistant Staphylococcus aureus, because for MRSA we give Vanco, and if Vanco doesn't work, your patient has VRSA. Now, 20 years ago when I was in training, it was very rare. Nowadays, this happens like on days that end with Y. So again, now we know she's infectious, and it's something that we have to control, and it's something we have to do about. And now you could see that could be, this is the diagnosis, MRSA, and what was the plan? We're going to do a wound, CNS, culture and sensitivity. That means I'm going to take a sample of whatever that's coming out of her face, and I'm going to bring it to pathology, and pathology is going to tell me two things. The culture part, in about 3 to 5 days, they're going to tell me what bacteria it is. And then in the sensitivity part, it's going to tell me, the report will tell me what is the best medication to give for this particular patient, because it's obvious the first line medication is not working. She already has been diagnosed with MRSA. And let me show you what a CNS looks like. Oops, I can't type. Let me write the whole word. Now, if you've ever seen those Petri dishes, that's what a culture and sensitivity is. Culture, sensitivity, microbiology. How about that? There you go. How about this one? So you see this, all this fuzziness? If you look at the microscope, or if you look at it based on the different colors and what kind of medium, this is called agar, the gel that's all of this is in. Depending on what it looks like, that's the culture part. That's the part that tells me what bacteria it is. This is the sensitivity part. We now know this this yellow-green stuff, that's bacteria. All these little discs are antibiotics. And you could see which ones killed which one was the most antibiotic, which one killed the most bacteria. So between this one, A, B, and C, which one would you choose? You would choose C, because you see it killed the most bacteria. This one barely did anything. This one did some. All right, so that would be a nice question on a test. And also, that's something that now you know that a CNS, it takes days. It takes like 5 to 7 days to do. And just as a little side note, that's why I'm creeped out about the diagnosis of this current COVID. How can it be minutes? And that's a virus. It's something so much smaller. And also, by the way, I have a master's degree in physical chemistry. Oh, PCR, or preliminary chain reaction, last time I remember, requires a lab and at least a week. How does it require a swab from your nose in some mysterious kit? Something to think about. Just putting it out there. So let's look at the notes, because these are some things I could ask. Do you know the case? What was her chief complaint? And the reason why I ask about cases is, and it's really nice that your textbook has cases, is because what do you call that? It shows you how protocols are done, so that you can, the next time you see another Shayna Jones, somebody with an infected wound, now you know how it will progress, what kind of diagnosis we give. Now you know what MRSA is. Now you know what VRSA is, right? And that I have to now have some precautions. Now let's see if the pages match up. Ooh, look at this one. This is really important. Cycle of infection. Know your cycle of infection. And it all starts with a reservoir host. And this is really important to what's going on nowadays. There has to be a means of exit, okay? So one way, of course, is what? You can cough, right? Or in the case of COVID, you have to go touch something, okay? Then there has to be a means of transmission. So if you're coughing, it's airborne or droplet. And And if it's a direct contact, someone has to, like, let's say there's a pathogen on there, someone has to touch that glass. And then once you touch it, there's got to be a means of entrance. And let me tell you right now, another side note, maybe you've seen it on maybe some random medical show. A virus is very small. Within a millimeter, you could fit like 150,000 of them on there. It'll go through your N95 mask. It'll go through your skin. It'll go through your clothes. It'll go through your cells. Another thing about a virus is it doesn't have its own DNA or RNA. It hijacks yours. So that's, again, another thing to think about, this whole thing that's going on, right? Something that small. And why doesn't everyone get sick, right? You just see now with like the way CNN reports it, because we hit the 100,000 mark. You have to ask yourself, how many people are there in this country? So do we have a lot of susceptible hosts, right? Yeah, we have a decent amount, but it didn't hit as many. So these are the things that you have to start looking at. But 100,000 still is scary, especially to a lot of people. But do know and understand, the regular flu killed 27,000 people last year. And that's with a vaccine. Okay, that's with on the medical community watching out for it. So now you can see how the medical community got sucker punched on this one, and how relatively devastating that it had. So the susceptible host. You also may have seen reports. I've seen reports, but the current rate, according to the CDC, is 79%. 82% of all the people who died were greater than 79 years of age, because they were susceptible hosts. I only know of 2 cases of my mother's colleagues who've died. Both of them were well in their 70s and 80s. Both of them had multi-systemic problems like heart problems, diabetes, multiple diseases. And that makes sense because you're not young. Heck, I'm only 50 and I got 1,000,002 problems. And that means I'm a susceptible host. These other people were susceptible hosts, and then they got sick. And then when they get sick, again, it goes to other reservoirs. And that's why, that's the reason why medical professionals wear all those PEPs, because why? They're exposed all day. You're stressed out. What then you become? You become a reservoir host, and then the chain keeps on going. Now, what the CDC and the government and everyone else is doing is they know and understand this, and they're trying to break the cycle. And one of those ways is, because I can't control the means of exit. I can't control, well, I'm going to try to control the reservoir host, but I can control the means of transmission. If it's by droplet or direct contact, if no one has any contact with each other, no one gets into small spaces, and no one touches each other, then we break the chain. But again, back to viruses, they're really, really nasty little things. The thing about this virus is we're sketchy on the diagnosis. That's number 1 already. And number 2, we have no vaccine. We have no cure. So it complicates this, and it propagates the cycle of infection. Okay. It's also the reason why, you get food poisoning and that stuff, and you see those signs like, oh, employees must always wash their hands. Just like us, we must always wash our hands. CDC guidelines currently must stand for anytime in between patients, at least hand sanitizer if it's non-invasive. If you're just taking taking some vital signs, or you're just doing a chart. But nowadays, I would highly suggest hand washing in between every patient on everything, and PPE on everybody, because of what's going on. And again, it goes less of you contracting it, more of you bringing it to another susceptible host, most likely someone who is older, someone who has multi-systemic problems. And I mentioned airborne already. That's, of course, droplet infection. You inhale it. Bloodborne, like HIV. or sexual transmitted diseases. Transmissions during pregnancy, that's another way. A classic is STDs and syphilis for contract sex workers and those kind of things. Foodborne, of course, we just talked about. Now, vector-borne, which is how COVID kind of started. Vector-borne, think that it started with some sort of animal, right? And some sort of animal started it or propagated it, and or some sort of insect. Like right now, since everyone's taking walks, my wife is a healthcare administrator for Inova. She's getting a decent amount of calls for ticks. And she was like, what's this tick thing? Because I read it in a book once. Well, tick is it's an insect and it carries a disease. And then you get Lyme disease, Lyme, named after some guy named Lyme, right? Same thing with mosquitoes, malaria, right? Flies and fleas, right? So that's vector-borne. You could get diseases. And again, back to, are you susceptible to the disease state? That's why, if you recall your anatomy physiology, also keep your keep your stress level down, because you increase stress levels, it increases your cortisol. You increase your cortisol, it'll drop your immune system, and then you get sick. I like to quote that everyone gets excited around February because it's cold and flu season. I don't think that's it. I think February is tax time. Also, beginning of February, end of February, that's when you get the bill from all the stuff that you put on your card around Christmas time. And it gets stressful. And then you get stressed out, you get a little sick, right? Me, like clockwork. February, I have a severe lower respiratory tract infection. I mean, as in severe enough to be almost hospitalized. Hand hygiene, we talked about hand washing, alcohol-based hand rubs, hand sanitizer. And again, prior to this COVID, if it was non-invasive, you could use your hand sanitizer. But I think clinically now, if I had my own clinic, everyone's washing hands in between. Bloodborne precautions. Now, it doesn't matter if you're HIV positive and you work in a laboratory or you work in a doctor's office, because universal precaution states that everyone is HIV positive. You have to treat the world like everyone's infectious. So you have to run all the protocols as if blood, sputum, any sample is toxic waste. So you're always gloving up, you're always handling it like it's explosives. And if you're always doing that, you'll never get an incident. And so paper towels, linens, everything's clean, making sure that you put everything in the biohazard that needs to be put in the biohazard. You may have seen a really nasty habit that a lot of clinicians have, both doctors and nurses. They just leave their stuff out and they don't deal with it, because again, you have a ton of patients, you want to try to get to your next patient. You know, sometimes the asepsis lacks. This is my rule. I never leave a clinical room dirtier than when it arrived. So if I get into a dirty room, I clean it and see my patient, and then whatever I messed up, I put away in the proper biohazard disposal. I don't wait for sanitation services to go deal with it. And that's universal precautions. Uni means one. You're always assuming that that everything you're touching is HIV positive, and there's all these protective measures, right? You see this person, they're gloved up, and this is a surgical fashion. See how their gloves go over the cuff of their lab coat. And by the way, Don't be one of those people who wear their scrubs and their lab coat in the mall, right? That's like telling a cop, like when he's off duty or when she's off duty, to wear their tack vest. That's being silly. And also those things, your PPE protects you where at these high risk places. That's part of the protocols that we'll be having at Stratford. You guys will not be bringing. You have your own masks coming into the university, and you have your own lab coats. But guess what? You'll be wearing disposable masks and lab coats while you're there, and when you leave, you remove those, and that's part of the protocol that's being proposed right now. And that should be the same way in the hospital. When I was working in the hospital, I don't go home in my scrubs. I go home in my street clothes. So I come in for the shift. I remove my street clothes. I wear my scrubs, or I wear whatever prescribed uniform that I have for the day. And that's the day. And then I have house cleaning services or sanitation services deal with my scrubs or whatnot. And if it's my own personal clothes, I put it in a plastic bag and I washed it separately from my family stuff, because the exposure that I had at the time, I had little children. Who am I kidding? I still have little children in the house. I'll forever have little children in the house. So if you have that idea and that protocol, it keeps you safe and keeps your family members safe. Alrighty, that's nice. Hand washing, that's nice. And again, by the way, if you want to, if you're having issues sleeping, take a textbook and read it cover to cover. You'll be dead asleep in no time. But the way I'm going through this, I'm going through it with the knowledge of going through the goals of what we have, what we need for today. Okay. All right. Exposure incidents, exposure plan. Now, every laboratory, every doctor's office has to have some sort of ECP or exposure control plan. There's got to be a binder that says, this is what we do when this happens. Because remember, if you don't have a plan, you're going to be running around with your head cut off, right? And after the plan gets executed in the same binder, which, by the way, OSHA inspects, you have to fill out an incident report. I am happy to say in all my years at Alexandria, we have 0 incident reports after the hundreds of students that went through our laboratories. And when I was at Falls Church, we had 1 stick incident, just 1. But again, what happened? Even though the incident didn't transfer any blood, the student accidentally pricked herself with a needle while opening a cap to one of the syringes. We did what? We wrote it up and we put it in the binder so that everyone can see, and that's called transparency. And that's how OSHA looks for, right? Because there will be hiccups, there will be problems. Another type of incident that's also common is, let's say, for example, you drop blood or you drop the sample on the floor. You can't use it anymore, but that's nowadays the kind of tubes that we have, they're shock impact resistant plastic, not like glass like the old days. So we still can't use the sample, but an incident report has to be written up that you did drop a sample on the floor. Needle stick safety, we just mentioned that. And again, when if you recall, if you've taken your what's that class called again? If you've taken your phlebotomy class already, you know that there's a specific protocol. There's a specific way of doing things, and that's what's going to prevent you from getting hurt. There are a ton of rules and regulations in all hospital settings, in all clinical settings, and every single little rule is there for a reason. That's why I don't like shortcuts, because it becomes a slippery slope. Once you start doing some shortcuts, that's when bad things start to happen. I make it akin to like driving. Do you remember the first time you ever drove a car? It's like you were very, very strict. You didn't run red lights. But now I drive with like barely one finger. I'm texting in one hand. I'm barely paying attention. I'm going too fast. You do all of these little shortcuts, and they culminate in a very dangerous situation. So remember, once you're in play and work, follow the rules and regulations. Do not deviate from them. Now, this is a nice part to look at as well, because it now outlines why we have PPE, why we have personal protective equipment, because there's all these precautions. And again, distancing is one of them. And at the very end of this chapter, it's got all the things that we're going to be talking about in class on how to do. Okay, so look over those. But I think what I did is I scanned those particular pages, and then I what do you call that? I put them I put them separately. Let me show you. If you see here, I put it here so that you're not flipping back and forth in the book. You went right to the hand washing rubric. So that's pretty much chapter 6. And I talked about some other stuff, but here you can see how it's all in there, and you can look at all the procedures. And then when you're answering, as you could see, I believe the pages were all off. They're all different, but it is in chapter 6, and all the procedures are in that blue book, right? And all the procedures, they're labeled like this. And or you could look at them at the end, like at the end of chapter 4, there's the procedure, how to deal with the anxious patient, how to deal with the angry patient. At the end of chapter 6, aseptic hand washing, how to use, how and when to use alcohol hand disinfectant, AHDs, and how to deglove, how to remove your contaminated gloves. And again, we'll be going over all of these again, and especially with anxious and angry patient, we'll be doing some role playing in laboratory where I get to play the anxious patient, I get to play the angry patient, and you get to deal with me as per the protocol. So let me close that. Let's go over chapter 9. Now, chapter 9, I'm going to go over this part. Now, the furnishing, the American Disabilities Act, and accessibility stuff, you could read that on your own. That's pretty straightforward. What's golden on chapter 9 is this. This is sanitization, disinfection, and sterilization, the 3 levels of asepsis. In order to get the sterilization autoclave, you have to go through level 1, then level 2, then to sterilization. So let's say, for example, I want to autoclave something like a medical instrument. I got to scrub it. I have to put it in a neutral pH solution for a while. I have to categorize it. Sharps go with sharps. Hemostats go with hemostats. Now, what do we mean by sharps go with sharps? So you know exactly what's in that fluid, because sometimes it's bubbly and you might not see it, and you have to be aware of what you're sticking your hand into. And I'll also show you in lab how we do that, right? And there's a process, and there's also there's also ways to sanitize rubber and plastic products, and again, neutral pH solution. Also, we have ultrasound cleaning. That's at the sanitization level. Sanitization level is the lowest level of asepsis. The next level is disinfection. If you look in chapter 9, somewhere in there, there's an antiseptics and disinfection page. Look at that. It gives you all the reagents that we typically use in a clinical setting and what they're used for. And look up and research, oh, what do I use to clean up blood? What do I use to clean up mucus? What do I use this to clean up my stethoscope? And that chart in chapter 9 regarding the antiseptics and disinfectants, that's golden. And last but not least, we'll definitely go over in laboratory, is autoclave, how to use the autoclave. But essentially for now, autoclave is the highest form of asepsis. In theory, once it comes out of that autoclave, there should be no bacteria, virus, or anything in there. But in real life, asepsis isn't 100%. And once you sterilize something, it has a shelf life. Typically, in a clinical surgical setting, I don't keep the stuff more than a week or so. And if you're in a good office, it'll be used up within the week anyway. They say 7 to 10 days, but I usually do it a week. And autoclaves can either use pressure, like a pressure cooker, heat, or both, to kill off any bacteria or any potential pathogen. And so that is golden on chapter 9, right there. Hand hygiene rules and regulations, we already kind of went over. It's kind of a repeat. And for this class, when we get closer to the laboratory, I'm going to put out instrument identification. But look in chapter 9, it's like some of the basics of instrument identification. But I have an expanded version that includes like all the hemostats and all the different kinds of scissors. So that because in laboratory, I believe our second laboratory will be doing mock surgery. We'll probably just mess with the pigs that we cut up in anatomy and physiology. I'll save 1 or 2 of them. And then, in that lab, it's kind of fun. I also show you guys how to sew stuff up. So we can do that then. And that's the main thing in chapter 9. All it is that 3 levels and this antiseptics and disinfectant page that has a list of all the antiseptics and disinfectants and what do you use them for? What do you use them for? All right. So with that being said, everything that I also discussed is in also an older video from last year. That's right here. And I'll be also posting in announcements up here the recording of this particular class. All right. Okay, let me put you off mute if you have any questions.
If you have any questions.
One of the questions I do have, when we are doing the discussions, is there a word limit? And if you respond to a another classmate, that have to be stored as well.
Well, right now, don't respond to your classmate. Right? Don't respond for the classmate for this week. Work on just having a good, solid 200 to 300 word response with a good introduction, opinion, rationale, and citation. And you could follow these rubrics. Ooh, let me move this out of the way. You can follow these rubrics here. You can click on this as a Word document and citation. And then let's click right down here. And then, of course, so I wouldn't worry about right now responding to somebody, because responding to another student is the same exact thing. Because one thing that you probably saw in other classes, the way people respond, let's say I like what Miss White said. Hey, Miss White, you did really great. I love what you said. So what? Right? If you like what she said, you must find evidence to support what she said. If you don't like what she said, you must find evidence that refutes what she said. Like, for example, she found something from 2016 that said A, B, and C, but 2019 data says CBA. That's the way to properly respond. But for right now, just do your initial response, and that will be more than enough for full credit. I want to see where your guys' writing is at, and also once that's solidified, then we can start responding to each other. Okay?
Okay.
Okay.
All righty. Thanks very much. Have a good one.
Yeah.